89.7 FM.
With that, you're most welcome aboard Ultimate Health on Joy 99.7 FM. Listen every Sunday, 2:05. By His grace, we are live.
Joy 99.7 FM.
As you know, if it impacts on your health, your well-being, your quality of life, I'll bring it right into your homes, your offices, your cars. My name is Nortey by nature. This is Ultimate Health. Let's take some log on music. Felix Owusu Wabin. Delicious, huh? Easy to digest. We call it Ultimate Health on Joy 99.7 FM. Listen every Sunday, 2:05. And we're serving right now. Last week we started the journey trying to understand the impact of current weather and environmental conditions on our health. We're continuing today, drilling down on some of the common names and terms. What is catarrh? How different is it from cold catarrh? What's bronchitis? What's pneumonia? What should you be doing about it? Should you be, fiddling, fidgeting with it yourself? Self-medication? That's what we're getting into on Ultimate Health. Remember, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. My name is Nortey by nature.
Joy 99.7 FM.
And this week we have coming back to join us and to educate us and inform us Dr. Emmanuel Asante is a specialist family physician with the Ghana College of Physicians, and he works at the Medina Polyclinic. He's the president of the Ukraine Trained Professionals Association of Ghana, and he's the director of biblical studies at the Zion City Theological Seminary. Dr. Asante, good afternoon.
Yes, and good afternoon to you, Nortey, and your cherished listeners.
Right. Today we have you solo. Pascal couldn't join us today, but we're most grateful that you've been able to join us. As I said in my intro, we're continuing. We started by looking at the impact of current weather and environmental conditions on our health. We are aware of the dusty conditions, the Harmattan, which is currently, active, and we discussed quite in some detail the impact. We wanted this week to drill down a bit and get to understand the common signs, symptoms, and presentations of some of the common ailments, typically or primarily respiratory, that we hear about. So we're glad to have you. So let me start with, some of the terms. And we commonly hear catarrh. I've found out that it's really not a Ghanaian term at all. Actually, it's quite an established medical term, catarrh. What exactly is catarrh?
Okay, so thank you once again, Nortey, and your cherished listeners. So, catarrh in itself can be an ailment, right? That affects the upper respiratory tract system, specifically, right, the nose and the throat, all right, where you produce a lot of exudate or mucus, so it makes your nose stuffy, right, and then your throat stuffy with mucus. So mucus simply meaning, the fluid production that tends to collect or accumulate as a result of the inflammation. And again, the inflammation can come from irritants. It can come from infection, mostly viral and all that. And a lot of the time, it's self-limiting. So you realize that once somebody with catarrh will be sneezing a lot and will be bringing out a lot of, discharge from the nose, what we call rhinorrhea or, nasal discharge and what have you.
Right.
Okay, so it usually will not last more than a week. It's self-limiting. And like I said, a lot of the time it's viral. And as one takes good rest, one takes in some supplement like vitamin C, which tends to, resorb or take out the fluid from both the throat and the nose, hydrate and rest. It's self-limiting and it resolves in the process of time. A little bit of discomfort, but it resolves.
Okay. So catarrh is the buildup of mucus in the nose, in the back of the throat, right?
Yes.
And it causes difficulty breathing, right?
Yes, at times.
At times, okay. I've seen it described or named or termed post-nasal drip. Can you explain to my listeners, Doc? Typically and normally, the body does produce mucus. And unconsciously, we swallow this and it's just of no consequence. But this is a more significant buildup that causes the symptoms you just described, right?
Yes.
So my understanding is that mucus has a purpose. Can you just explain that for my listeners?
All right, so thank you very much. So you see, with catarrh, the mucus that build up in the nose and in the throat as a result of an irritant or a virus, tends to cause congestion in the nose. So that's why there's difficulty in breathing.
Right.
And then you tend to have a lot of mucus build up in your throat. So you tend to cough a lot of the time. Mm-hmm. Now, you see this mucus lining in the nose down to the throat, helps prevent, serve as barrier points to prevent any invasion of any kind of a foreign body or external, material from, invading your system.
Right.
It serves as a shield as well. And also moisturizes the respiratory system right from the upper areas down to the throat, and even way down to the lungs itself.
Okay.
Now, they become excessively produced when, it's irritated by an irritant themselves or a virus or a bacteria. That is when they become excessive in their production.
Okay.
And as a result, will cause a lot of discomfort, like sneezing, difficulty breathing. It irritates the trachea, the pharynx region, getting down to your lungs and all that. That is your trachea down to your bronchi.
Right.
And what happens is that it triggers cough. So the body's attempt to try to fight it off is what results in the cough and the discomfort for the individual.
All right. Great education there. Dr. Emmanuel Asante is educating us. We're drilling down a bit on some of the common presentations. I've just gotten him to explain what catarrh is, some of the known causes, and some of the signs and symptoms. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone line so that there's no congestion. But we're trying to educate ourselves, and we're also linking this to the current and prevalent weather and environmental conditions. So if you have any questions, concerns, you're welcome to share them on WhatsApp 055 11 11 997. Right, Doc, you mentioned some of the possible causes, and I see in my reading some of them are directly linked to changes in weather and so on and so forth, which is part of our focus in this. But again, so from what you've just explained to us, would I need to see a doctor? When would I need to present? If it is time or self-limiting, and typically it will go by itself, and you mentioned rest and a few other things, do I have to worry about catarrh if it's going to be about a week or a little bit more, and it will go by itself?
Yeah, so thank you. So as rightly said, you remember that the Ghana Medical Association, brought out a letter that we stated, the current trends in the season with the public, and it is important that we abide and stick to it. So as we've said, some of the conditions that normally present in this current Harmattan season are self-limiting, even though may create a bit of discomfort for the human body, especially if the person is an expert or maybe is not really used to the pattern of this kind of weather.
Okay.
So we say that if, for instance, you've been sneezing, you've been coughing, you've been having here and there congestion in the nose, which is causing, discomfort in breathing, and you've rested, you've taken enough water, you've gotten yourself all these over-the-counter medication like vitamin C, and you are not seeing progress. Like I said, it's a case-by-case scenario. All right. So someone may have the situation where he's done all that, but within just a day or so, it is turning out to be worse, where he's not able to breathe properly.
Okay.
Where he's coughing consistent and persistently. All right. And having general body pains and malaise, to the extent that he's even vomiting in the process.
Okay.
All right. And is having fever, temperature, chest pain. So when you realize that your situation is not really resolving after doing all that we've educated you, or we've discussed with you, or we shared with you on, you need to visit any nearby health facility.
Okay. And
Nortey, you mentioned about post-nasal drip.
Yeah.
All right. It's one of the situations where you see the mucus buildup in the nose, right, and all that can sink down and irritate the trachea. I mean the pharynx getting down to your larynx, which is into your trachea, down to your lungs. Right. And when that happens, if the person is already a known person with a chronic obstructive bronchial disease or asthma or any other respiratory tract infection, it can trigger it can trigger an attack where the person will have shortness of breath, the person will have, all from the catarrh that the person has had, where the fluid now finds its ways, getting down into the
backwards and downwards.
Yes, backwards and downwards, and irritating and triggering an attack where if the person is asthmatic, you start having crisis and what have you. And then if somebody is also having gastroesophageal reflux disease, where the acid from the stomach content, climbs up. It can climb up, right? The acid can climb up and come and irritate the larynx, getting down to the trachea, and can also trigger an asthmatic attack.
Doc, I take
or any other respiratory tract infection.
Right, thank you. Doc, I take it from what you're saying that the individual or personal history is also important. If you already have allergies, if you're already asthmatic and reactive to some of these things, then even though it starts at catarrh, it can irritate the system and cause various other presentations.
Yes, rightly so. Exactly. So that is why we are much particular about people with an existing chronic medical condition like bronchial asthma, like COPD, what we call chronic obstructive pulmonary diseases, like all these emphysemas and all that. And even if the person is having a heart condition or what have you, ages from 65 years and above, children below 12 years and all that, these are people who find themselves in the risk group. The risk group. So it is important that they are very much aware of the current weather pattern and take precautionary measures.
All right. So if you just joined us, this is Ultimate Health on Joy 99.7 FM. We're discussing and drilling down, peeling off the layers with regards to various respiratory presentations that escalate or increase during these weather and environmental conditions. We've just been speaking with Dr. Emmanuel Asante. He's a physician specialist, and he's based at the Medina Polyclinic. If you have any questions or concerns, our WhatsApp is 055 1111 997. We're live on Facebook and YouTube. Let's do some more work. Doc, so this ties it up nicely for us with regard to catarrh. I just wanted you to, break things down a bit. When you say trachea and you say larynx, right, can we liken for our listeners, even though I know they're very discerning, the trachea being the windpipe, right?
Exactly.
Okay.
Yes.
Right? And when we swallow, that is covered nicely so that what we swallow doesn't go into our windpipe.
Doesn't go, exactly.
Right? I don't want to go into glottis and epiglottis and all that. But so the trachea is the windpipe. Okay?
Yes, exactly.
Right. And then the larynx you mentioned is what we call our voice box. Am I right?
Yes.
Okay.
Yes.
So we're suggesting, or we're actually learning that this condition can progress and irritate and affect all these lower systems. And then you further said going down into the lungs and the tubes of the lungs. We're getting there. Am I right?
Yes. Yes, exactly. We are getting there.
Okay. Right. Great stuff. My listeners will bear with me because some of you seem to feel at certain times we get a bit too technical or maybe ahead of you, but we want you to understand. We want to equip you, empower you, and transform you. So if you have any questions, concerns, WhatsApp 055 1111 997, and we're live on Facebook and YouTube. We're focusing on some of these respiratory presentations. Okay, so that was catarrh. Can we distinguish catarrh from cold? We hear cold. I have a cold. I have catarrh. Is there any distinction or qualitative difference, or is the value the same?
Yes. Well, okay. So thank you. So when we say common cold, all right, common cold, refers to another, we also call it nasopharyngitis. Okay. All right, where the pharynx, and then the nasal cavity, these two, are involved, and then they get inflamed. Yes, the symptoms of common cold
right.
can be somewhat similar to just catarrh. All right. Mm-hmm. But then the thing is that with nasopharyngitis, okay, it is not just about the nasal cavity, which is inflamed, but then the pharynx, which is down the throat, okay, mm-hmm. is somewhat inflamed. The flesh down there is inflamed, and this inflammation can narrow and makes even swallowing of food difficult, because then food will pass there before it even gets, at the back of the trachea into the esophagus and go down there. All right. So they tend to experience a lot of, problem swallowing, a lot of coughing. Right. They tend to experience, when it is not managed well, it can get, infected. And then fever and all that will set in. They tend to have their lymph nodes, mm-hmm. right? Their lymph nodes, which runs down the neck and all that, inflamed and swollen. Okay. So comparing it with catarrh, clinically, it is not. It may be self-limiting, but then if you fall under this risk group, it can really worsen and can even close your throat up, okay, and mm-hmm. affect your breathing. Wow. So it can, compared to just catarrh, this can turn out to be, a worsening form.
Okay. Right. Folks, it's getting interesting, but again, I'm wondering what you've been doing, if you've been experiencing any of these symptoms that Dr. Asante and I are discussing. You can share those with us on WhatsApp 055 1111 997, and we can discuss them and get you answers. I see. Doc, were you still talking? I could see some movement.
Yes.
Okay.
So right. Yeah. So like I was saying, just comparing it to catarrh. Catarrh is self-limiting. Okay. Right. And it easily dies out, right, just within some couple of days. But with nasopharyngitis or common cold, which is also, influenced or can be caused by irritants, changing mm-hmm. weather patterns, right, virus or bacteria, it can stretch for quite some time, all right? And especially, it is not just about the nasal cavity, but then the pharynx getting down to the throat becomes so much inflamed, and it affects even your swallowing pattern, difficulty swallowing, painful swallowing, and all that. And fever can set in, coughing, and all those constitutional symptoms that we mentioned earlier can set and can take you, on a longer journey. So we advise that, if you are part of those risk group, it is important that when you experience that, you come to the hospital. It can really be that severe and not that self-limiting, unlike, just common catarrh.
Okay. Doc, another interesting and common question. Is it infectious or contagious? Can I get catarrh from somebody or pick up a cold from somebody?
All right. So thank you. So like I said, the causes, the causes are a lot. And as I earlier mentioned, it can be from irritants, allergens, infections, and all that. So we have a lot of people walking around, sneezing and coughing and not observing all these, coughing etiquettes and what have you. Right. So mostly through area droplets, one can easily acquire it. Okay. That is if it is viral. Right. Okay. So just through area droplets, right? If the person is coughing, is not observing any coughing etiquettes and all that, you can easily contract it just through breathing alone. Okay. All right. Now we are having Harmattan season where there are a lot of fossils, fumes, people burning things here and there. And obviously, if you have any existing chronic respiratory condition, you can trigger an attack. Okay. All right. The irritants can, attack your nasal cavity, break down the membrane, and produce a lot of your body's attempt to fight it off will produce a lot of exudate or mucus, and you can so. If it is irritants and all that, you contract it through the negative environmental factors that we earlier mentioned. Right. But then with the virus commonly encountered and the bacteria, yes, you can contract it through area droplets from one who has already contracted the condition.
Right. Thank you so much, Doc. Let me give you a breather. Folks, we're talking about the impact of current weather and environmental conditions on our health. We're following up this week by specifying and giving you the correct descriptive picture for each of the common terms and conditions you hear. We've just been breaking down the common cold and catarrh, right? So if you've been with us from the start of the program, you will have a bit of an insight into these. We'll be looking also, based on the causes, the symptoms, and so on, at what the line of treatment and management should be. Many of us in our discomfort would go to the nearest pharmacy, chemical shop or store and pick up some over-the-counter relief, let me just call it that, or products.
Yeah.
Okay.
Yeah.
Are we doing the right thing? Does it do anything to these conditions, or is it that the condition is taking no notice or cognizance of what you're doing and it's just resolving by itself? All right. Meaning that maybe we're making money for those selling the products and we don't properly understand the condition we're dealing with. We'll come to those. Abeku, is it possible to switch and have a look at the WhatsApp so that I can deal with some of those? Okay. Right. Good afternoon, doctor. I have heart enlargement. Even though I am on drugs for that, I cannot walk well. And I have difficulty in breathing and body pains. What do I do at the moment? This is Emperor from Adidome. So heart enlargement and then related, which is under treatment.
Mm-hmm. So it means that he goes to the hospital. He's being attended to.
Yes. And then he has difficulty breathing, body pains, and so on and so forth. Any quick comment on this before I read the next one?
Yeah, so quick one. So, so as you mentioned, on treatment, so it means that he's been attended to.
Yep.
Hopefully.
Mm-hmm.
All right. So if that is the case, okay, this weather pattern really is not convenient for him. He falls under the risk group, as we mentioned.
Right.
So if he's having difficulty breathing, obviously, if you are having heart conditions, blood circulation with oxygen is impaired. So then a lot of the time you can have issues. And then, of course, if it is a heart condition which is affecting the right side of the heart, of course, port pulmonale and the lungs will be involved. And, you may have a lot of condition issues with emphysema and what have you. So I wouldn't want to drag it too much. I would advise that individual to visit, the nearest hospital so that we look at it. Because it could even be a clot sitting somewhere and preventing you from breathing properly. Okay. So we don't take chances. You should quickly visit the nearby health center and then you'll be attended to.
Okay. Right. Thank you, Doc, for that. WhatsApp is still active, 055 11 11 997. And we'll activate the phone line shortly. Doc, so let's do a few more and then come back to treatment modalities and those that are effective or efficacious, right? And those are just basically redundant, but I don't know whether it is street medicine or whatever, seem to be prevalent, right? People do what they hear, right? And so we'll talk about that. Can we talk a bit about bronchitis?
Okay, so all right. So bronchitis too, of course, is a respiratory condition which affects, right, the trachea, one, and then the bronchi. The trachea goes down and divides into two. Okay. What we call bifurcation, tracheal bifurcation. So one goes to the right, one goes to the left.
So this is good. Sorry, Doc. We're heading towards the lungs.
We are heading towards the lungs. Okay.
We're talking about the pathway to the lungs.
The pathway to the lungs, if you will.
Thank you. Yeah.
Mm-hmm. So once it divides into two, the bronchioles, the bronchi forms. Mm-hmm. So just at the point of the division, right, left, one to the left, one to the right, the bronchi is formed. Okay, so and it continues. We have other forms of bronchi, what we call bronchioles and all that. Okay. But bronchitis specifically affects the trachea, right? The lining of the trachea, the mucous lining of the trachea, and then the bronchi itself. That is when it divides into two.
The tubes that go into the lungs.
Yeah, when it starts going into the lungs, yes. Okay. The upper one third of the division is what we call the bronchi. So when there is an inflammation in the trachea or the bronchi, that's what we call bronchitis. And usually the causes are, from irritants, from viruses, from bacteria, and a whole lot. But commonly, right, it is caused by viruses, right? The respiratory syncytial virus infection, the H influenza infection, and the list goes on. Okay. And usually when it happens like that, because of excessive mucus production in the trachea and in the bronchi, right? It closes and narrows the lumen, or narrows the tube, these tubes through which air passes in, oxygen and all that goes through, and the person finds it difficult to breathe. Right. Because of excess mucus production, it irritates cough, the person coughs a lot. All right. The person develops, how do you call it? Mucus accumulation in the throat. Right. So he brings out a lot of sputum. And the coughing can continue for a week or two. But a lot of the time it's virus. And viruses, we don't advise you to rush in for any antibiotics. All right. We advise that rest, taking a lot of water, hydrate, all right, and taking paracetamol and vitamin C. Okay. If it persists, or if you find yourself in the risk group, 65 years and over, you are 12 years and below, you are asthmatic and all that, you have any existing respiratory ailment, you need to come to the hospital. Okay.
Right, folks, you just heard Dr. Asante detailing or describing the features and characteristics of bronchitis, right? Irritation, inflammation of the airway, the trachea, and the tubes leading into the lungs, right? Exactly. When they get inflamed, then that is a different, should I say, condition, and it is lower down in the respiratory system. And he's talked about the signs and symptoms. Doc, I'm just reading. I pull up, stuff to augment my reading. I see here that it can spread in various ways. Usually it's self-treatable, right? And you can even have a sense of some self-diagnosis. But I see here that it can spread by airborne respiratory droplets when somebody coughs or sneezes.
Exactly.
By saliva, through kissing, shared drinks, and stuff like that. And
yes, those are rare cases.
By skin-to-skin contact, handshakes or hugs, and touching contaminated surfaces. So
yes, where you put your hand, you touch them and you put it in your mouth or your nose.
Wow!
But those are rare cases. You understand? Those are rare cases. But the commonest is through aerial droplets
when somebody and all coughs that. And
the rest are rare cases where maybe of course, if you are kissing saliva somewhat, it's exchanged. So the person is having a severe form. Yes, the virus can spread. But those are rare cases. Okay. You touch a mildew or surfaces that are contaminated by aerial droplets, and you pick your nose or your mouth or even your ears. Don't forget, the ears, the nose, and the mouth has a connection called the eustachian tube, which meets.
Right.
It meets at a point in the throat. So these are all points of entry, all right? Right. But these are rare cases. But most commonly, it is through aerial droplets.
Okie dokie. Right. Let me activate the phone lines. 030-221-6541. 030-221-6541. Those are the buttons to push, and those are the digits for Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm speaking with Dr. Emmanuel Asante, specialist physician, and we're tidying up but drilling down on some of the common presentations. This one says, good afternoon, Nortey. How are you and doctor? Thanks for your topic today. Please, I'd like to know the organ responsible for producing mucus in the human system that tend to catarrh to affect our respiratory system. Secondly, if this organ has been known by physician assistants, can they produce any drugs to prevent this and not have it in the human system again? This is from Hayford in Bator, now a regular listener. We touched on the fact that the body needs to and normally produces mucus, and it has a protective function. So before I allow Doc to come in, Hayford, what you're saying is that we should remove the protection of the organ or the factory that produces this protective mucus, and then you specify physician assistants. I'm not sure why, but you want them to get in on the business. Let me read another one, Doc, and come for an answer to that one. My son My son has had this catarrh for a while now. It goes and comes. We've been to the hospital. All they give is antibiotics or some vitamin C. Sometimes his temperature goes up. He is 2 years old. This is from Kobe in Osu. So recurrent catarrh, he suggests, right? And the treatment they are given is antibiotics and vitamin C. And he does see a spike in his 2-year-old's temperature. This one says, Nortey, is doc saying when one is coughing, it's just resting and taking water without medication? How can the cough stop? Right? He related it to whether it was viral or so and so, but we'll get an answer for that.
Yeah, we will. Clarify that.
Doc, please note them down. I'm trying to do justice.
Okay.
And not cause inflammation or congestion on my airways. Right.
Okay.
This is Sarah Manful, I believe, in Winneba. Nortey, thanks for your lovely high life selection this afternoon. And thanks to you and Doc for educating us this afternoon. Have a lovely Sunday. A lovely Sunday to you as well, Sarah, in Winneba. Right? Is there anything else? Click, 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 click. Okay. We're cleared. Right. We have somebody on the phone line. I'll call that the track here. Right. Hello, good afternoon.
Yeah, good afternoon, boss. I hope you're doing well.
Hey, Ajingo the man.
Yes, I was.
Right, share with us quickly.
Yeah, I think exhaustion, that smoke coming from vehicles, dust can cause that catarrh. But for me, I'm experiencing something that if I don't have enough sleep continuously, then sneezing continuously, then later coughing, then catarrh, then flu. I don't know the reason why, because I was thinking,
slow down.
Is the dust
did you say
only that should cause me that? So
did you say that if you don't have enough sleep,
if I don't get enough
sleep, right?
Yes, sir.
Then what happened?
Then this catarrh thing, it will start by sneezing continuously, then later flu, cold, then cough follows.
You see, you're stringing together diagnosis. I don't know your qualification, right? But I get the thrust of your question, right? We don't know the conditions under which you sleep and the conditions that cause your sleep deprivation. But, Doc, any answer for Ajingo?
Okay, so Ajingo, yeah, so as rightly said, poor sleep hygiene in itself is detrimental to the human body with your BP, stress, psychological challenges and all that. But then there are times that maybe where you are residing or you are sleeping, there may be irritants, okay, allergens that may not be known to you, that you may not know about. You may even have allergens in certain foods that you may not be aware. All right, and irritants all over, the atmosphere in your room. Maybe the fan has dust, has a lot of particles, area particles that blows, and you breathe it in unconsciously, and that in itself can trigger, inflammation in your nasal cavity, your throat, and it is all your body's attempt to push those things off, to fight against all those foreign area particles that may have, invaded your system, and in the process you get the catarrh, cold, and all that.
Okay.
Yeah. So these are factors, and I believe that if it continues and persists, come to the hospital and let us identify the allergens or the irritants that are responsible for that through certain labs that we run.
Right, Doc. Hayford in Bator wanted us to get rid of whatever produces the mucus, if the mucus is a problem.
Yes. So Hayford, so the thing is this: all the mucous membrane linings in the human body, have mucous glands, and they produce, mucus which lines up the surface of the organs, the tissues, and all that. And the whole idea is to protect it, right? To serve as a barrier layer to guard it against. And this mucous membranes, a lot of the time, contains body soldiers in a layman's term, or we call it, immunoglobulins that fight off infection and all that. And they are produced in a normal amount. But then when there is an irritant, an infection, or whatever, they tend to produce in excess. And that is where, it becomes a problem.
Okay. So there's no business for physician assistants producing drugs to sort this out.
Yes, it's normal. It's normal. Okay. It's normal to have mucus production and all that. It becomes excessive when it is irritated.
Okay.
All right. And then somebody asked about coughing. Yes. So you rightly said, I was relating it to a particular incident. But then obviously, if you are coughing and you are having all these things,
Doc, let me just pause you to situate your response. You're referring to the person who was asking how rest and the other things you advised or recommended could resolve a cough. Is that the one you're responding to now?
Yes.
Okay.
He said that,
so that our listeners know the context of your response.
Exactly.
Right? Somebody is asking when you are advised to just rest and it will pass and run its course, right? They don't see the link. Yeah.
Yes. So the thing is that, you see, one can just cough in response to the body's defensive or compensatory mechanism. The body is trying to be defensive, right?
Okay.
Something has invaded your system. It is trying to bring it out. So in the body's response, you will cough.
Okay.
At that instant, it is not necessary to be taking any cough syrup or anything. You can just take in some water and relax. Mm-hmm. But in a situation where you have all this common cold, right, catarrh, all right, bronchitis, as we mentioned, yes, obviously, when you come to the facility or when you reach out to any primary healthcare specialist or physician, he will tell you, okay, taking hydrate, right, taking paracetamol, taking vitamin C, and cough syrup. These are over-the-counter medications that usually serve as first aid. So these things are supportive management.
Okay.
That ideally, if the condition is self-limiting, you should be fine in a couple of days, 3 to 5 days.
Okay.
But if it persists, it means that the medications are not working, and there could be more to that, and you need to come to the hospital.
Okay. Let's not forget also that some investigative labs and other things will be done to specify or identify whatever pathogen or bacteria or virus is causing this. Right. Exactly. I have another caller on the line, but Doc, don't lose the question about the 2-year-old with recurrent catarrh. Yeah, let me just take this call. Hello, good afternoon.
Good afternoon.
Good afternoon. Who am I speaking to?
Otibuate from Tema.
You're welcome, my brother. Share with us.
Yeah, Nortey. Good afternoon to you and the doctor. Sometimes doctors are split, but you see some people in the car, they split on the ground, and sometimes the air blow and it comes to your face, and sometimes you take your hanky to clean it. So I'm a doctor. After cleaning that one, will have effect, or just after this split flash on the blowing on the air on your face. Can something enter you to have this disease?
Right. Okay. Good one. He's talking about this indiscriminate spitting. Which is almost like a national sport. And he's saying that sometimes in a passing vehicle, somebody spits and then you get saliva on your face. Can you get, any of these conditions from that? And after wiping all the stuff, what else should you do? Doc, hang on to that. Let me take another caller. Hello, good afternoon.
Good afternoon, Nortey.
Yes, hi. Who am I speaking to?
You're speaking to Elijah.
Elijah, you're welcome. Share with us.
Yeah. Please, I need education on this coal or catarrh, the relation between them and ice water.
Relationship between some of these conditions and iced water, cold water.
Yes.
Right. Okay, that's a good one. All right, Doc.
Yes. So from the first question, the spitting. Okay, so if the person is not having any respiratory condition, usually, even though it's a bad etiquette, right? And we advise people to observe, good coughing or sneezing etiquette where you can cough into your elbow or maybe a tissue paper or a handkerchief and all that. You do not worry about. But for safety and precautionary measures' sake, you need to wipe it off with water. Okay, you need to wipe it off with water, wash it off, and you are good to go.
Okay.
Usually there's not, in rare cases you encounter issues of that sort, but hardly would you have anything. But we advise people to refrain from unhealthy respiratory etiquette.
Right.
Okay.
Essentially, Doc, the person has kissed you by force. Wow. Okay, but the advice is well noted, right? And then the next one, the 2-year-old with recurrent catarrh, spiking temperature, and the father says that they are given antibiotics and vitamin C.
By a doctor?
That's what he says. They go to hospital and they are given antibiotics for this catarrh and vitamin C, but it recurs, and then sometimes he noticed the temperature spike as well.
Yeah, so there's a condition we call hay fever or allergic rhinitis.
Yeah.
It has now been changed to the term rhinosinusitis, and a lot of the time it is allergens, irritants that is causing that, and usually it can be perennial. And of course, it is not far-fetched, especially looking at the kind of season we find ourselves in. All right, so it may not necessarily warrant antibiotic coverage. All right, we advise that rest taking all this vitamin C, cough syrup, warm tea, and all that paracetamol is good enough, because some of the antibiotics, because if it's viral or an allergen or irritant, I mean, antibiotics will not do much. You rather encourage antimicrobial resistance. And the medication going forward may not see the light of the day with other patients. So we advise that if it's persistent, for all you know, there may be an underlying condition with asthma or bronchiolitis, which can give all the symptoms that they're talking about. So then they should come to the hospital for proper investigation.
Right. You've just brought in warm drinks. Don't forget the question about cold water or iced water. I have a caller on the line. Hello.
Yes.
Hello, good afternoon.
Good afternoon, Nortey.
Hi, who am I speaking to?
This is Hayford from Bato.
Hayford from Bato, okay, right.
Yeah.
You wanted to suck mucus from the from the body.
Yeah.
Right, you're welcome, Hayford.
Thank you.
Right.
I would like to know the virus.
Pardon?
The cycle when somebody spits on the ground for hours and I still go and touch it and it will still affect me.
Okay.
I'd like to
so you want to know if the virus is resilient, right? Okay, great. Hayford is asking if the virus is resilient if somebody spits and he later, after a couple of hours, touches the whatever it is that, would he still find the virus active, and would he have a resultant health impact? That's essentially what he's asking.
Not really. I mean, obviously, the person is not, like I said, it depends on, whether the person having any condition. But a lot of the time, viruses are self-limiting and they come and go. So, most of the time, all the studies that we've done, looking at the scenarios that our callers have given, rarely will cause any problem. But obviously, in a pandemic time like this, where public health issues are of a challenge and of a concern, you need to take all the necessary precautionary measures. We talked about, putting on face masks, that covers your nose and your mouth, in a crowded area. Yes, to protect yourself against some of these area droplets, because not everybody who is able to observe this moral etiquette regards to respiratory conditions.
Okay,
so
great.
Let's protect ourselves, but hardly will
okay, I have another call.
The person's not having anything.
Right, I have another caller. Hello.
Good afternoon.
Good afternoon, sir. What's your name?
Yeah, my name is Bismarck. I'm calling from Tema.
Bismarck, you're welcome. Share with us.
Boss, I want to find out from you whether catarrh and cold is the same or is two different sickness. Because sometimes you go to clinic or you go to pharmacy shop and you say you have cold and catarrh. It looks as if they give you the same medicine. So I want to know from you, you are the expert, whether you have medicine for catarrh and you have medicine for cold. Because we are in Hamatan season. And you know the problem we are facing. That is my question I want to find out from.
Okay, but you come to Joy FM for 3 strokes of my cane because you joined late. We've talked about this, but we'll come back to it. He's asking that. So let's touch on the one about the effect or impact of cold drinks or iced water.
All right. So we know that iced water causes constriction of the blood vessels. In other words, it narrows the blood vessels, what we call inclina moja pneumono. It narrows it, and once it narrows it, it decreases the ability of the immune system, the body soldiers, to fight off, a lot of infection. So when that happens, it triggers cold water. So that triggers a lot of mucus production. Okay. It triggers a lot of mucus production. So that is what normally, we advise that cut down cold water and all that. It will constrict the blood vessels and constrict blood flow to whichever region, right, that needs it, and decreases the energy of the immune system to fight off, but rather causing excess production of the mucus buildup in the nose and the throat.
So it is worsening the condition.
It worsens. Yes, worsens the condition.
Would that be the same as causing it?
It will worsen. It will worsen and trigger.
Okay.
The flu and all those common cold and catarrh that.
All right.
But not necessarily causing it. But obviously we advise precautionary measures because too much of everything it is bad. So we would not say that. If you don't have any condition, just be drinking ice water all the time. All right. Let's try to moderate our intake of it.
Okay.
That's what I would say.
All right, Doc, what have you? Because Charlie, jokes aside, it's soothing, right? In this dry weather, all the dust. What better than a cold drink than cold? What happened? Some people go overboard where they take a lot of ice water. You can have a milder form of ice water. All right. Some are too icy. That's the concern. Too cold. Okay. Too cold. All right. Too cold. So it causes a lot of mucus production, and it impairs. Studies have shown that it impairs the activities of the immune system to fight off certain things, and then when that happens, a lot of mucus production, is produced, and yes, it can trigger off a common cold or something if you do it too much. Okay, wow, it's 2:54, and we haven't touched on pneumonia, Doc. It looks like our lines and our questioning paths have been congested and inflamed. Right? Is there anything we haven't answered? Conclusively?
Well, okay, spitting from the car, we've touched on it, we've educated them on the moral etiquette, and that you hardly will it cause anything. Obviously, if the person is having tuberculosis, okay, the person whose part is having tuberculosis, it should be a concern to you. You need to, check yourself up and all that. And basically, I think we've touched on it. And pneumonia is just going down to attack the air sacs.
Let's quickly do a sprint and give our listeners an understanding of what pneumonia is. We've got about 6 minutes, yeah?
All right. So basically, we've talked about bronchitis, where the bronchi is affected. Now, you travel down to the air sacs, the small sacs in the lungs.
Okay.
What we call the alveoli. We call it alveoli.
Okay.
What we call the air sacs, okay, where, air gaseous exchange takes place and all that. We also call it the tissues of the lungs, or we call the lung parenchyma.
Okay.
And that is where pneumonia takes place. So we've talked about bronchi, where the bronchi is affected. Now you travel down, right? The tissues in the form of air sacs, gets inflamed, okay? And pneumonia develops. So again, there's a buildup of fluids. There's narrowing of the tube, the air sacs. You are not able to breathe. There is chest pains. So gradually, in the process of time, fever comes in.
Right.
You start coughing. And you're releasing greenish or yellowish sputum.
Right.
Okay.
Doc, so
and when you breathe in, you feel pain in your chest. So that's where pneumonia also sets in. If even bronchitis is not well treated, if it's caused by bacteria and it's not well managed, it can travel down to the air sacs of the lungs, and now pneumonia sets in.
All right. So, Doc, the lungs should normally be free of fluid.
The lungs should normally have a normal pattern of fluid production.
Okay.
Which moisturizes the lining, the mucous lining.
Right.
All right. It becomes abnormal or abnormally produced in excess when there's an inflammation from a bacteria, from an irritant, from a virus, or what have you.
Okay.
So when it becomes too much, there's too much mucus production, and that too much mucus production blocks, closes the lumen or the tubes to in such a way that air is not able to pass through. That's why people struggle to breathe.
Okay.
That's why people struggle to breathe. They have chest pains. They cough. It triggers cough. They cough, and the too much sputum or mucus is what they bring out as sputum. Some are yellowish. Some are greenish. And what have you? Okay.
Right.
It can trigger and spread. Okay. And you start coughing and having fever, chest pains,
right.
And you can even start vomiting, because then some of these mucus can get down into your esophagus and all that and trigger, an urge to vomit. So that's really serious. Pneumonia can be that serious. And again, if you fall under the risk factor group, more than 65 years, you already have an existing chronic respiratory condition, children under 12, and all that, you really are at risk. Okay. And we need to take care. And we have vaccines for it, vaccines for pneumonia for the elderly and all that. So we also advise that people get.
Okay. So, Doc, there was a question about whether we should there exist separate treatment regimens for catarrh.
Yes.
For catarrh, cold, and so on and so forth. The caller was a bit frustrated that he could go to the hospital, he'll hear these names used alternatively, and he gets the same treatment. So he's asking, are they the same thing? And essentially, Doc, just a sec. Essentially, Doc, what I'm asking also is that there's a typical lay person's understanding that if the treatment is the same, then the condition is the same. So if we could tie this together and address that.
Okay, all right. So basically, you see, like I said, catarrh can even be a symptom of allergic rhinitis and can stand, on its own, right? If you, like I mentioned, catarrh basically is the inflammation of the nasal cavity, right, with some amount of mucus accumulation also in the throat. Okay. It is self-limiting, a lot of time caused by irritants and virus, and usually does not last, for more than 5 days. Okay. Okay. That is if the person rests, takes in vitamin C, to just absorb or suck out the fluid. Okay. Taking some, cough syrup where the accumulation of mucus in the throat triggers coughing and all that. The person is good to go. But with common cold, it's not just about the nasal cavity and just the throat, but then the pharynx. That is the region of the throat from where you get into the epiglottis and all that area gets inflamed. And a lot of the time, it comes with difficulty or painful swallowing and discomfort. Right. And it can stretch for a long time. So even though the symptoms may somewhat look the same and the treatment and management may look the same, common cold, what we call nasopharyngitis, can stretch over a long period of time, especially if the person falls under those risk groups. Right. So comparing catarrh and common cold, the symptoms may somehow look the same, causes are the same, but with common cold, it can be severe. All right. Unlike just catarrh. All right. Great. And the treatment, they are supportive treatment. All right. Yeah. So vitamin C, cough syrup, get some nasal drops. Okay, take hydrate because as you are bringing out the sputum or the mucus, you are dehydrating. All right. Okay. Taking some cough syrup, paracetamol, and rest. Okay. With this, a lot of the time we treat catarrh, it goes on its own. But with nasopharyngitis or common cold, it can stretch for a long time, and you need to, come to the hospital if this supportive management I just mentioned are not helping. Okay, great, Doc. We've run out of time, but just quickly, who should be handling these things? Do you just go to the OPD and follow the queue and the process? Do you go see a specialist, a pulmonologist? Who should be handling this? Just quickly. Yeah, so basically this is handled by the primary care physician. When we talk about primary care physician, we are talking about family physicians. Okay. We are talking about medical officers. We are talking about physician assistants. Okay. We are talking about nurse practitioners and what have you. And primary care physicians are physicians you see all over in our polyclinics, right? In our health centers, in our hospitals, right, and so on and so forth. So I know a lot of people, when they come to the hospital environment, at times can be a bit challenging and intimidating. So people, you go through the process, you have to do a folder. Okay. Come to facility, be seen. All right. So a lot of the time we work with a lot of professionals who consult us when they go and get stuff and what have you. So yes, so they can be attended to by that. And even at times with over-the-counter medications, right? The pharmacists have somewhat also been trained to just probably give out first aid. Okay. And recommend that if symptoms persist, right, after 3 to 5 days, they should come to the facility. Okay. All right. Thank you so much, Dr. Emmanuel Asante. Let me see, Abeku, can we quickly just switch over? Let me just see if I have any tidying up to do on the WhatsApp console, but we're out of time. Good afternoon, Nortey. This weather, this one says,
Good afternoon, Nortey, and your knowledgeable guest. Please, my son has been diagnosed with asthma. We've been trying to comply with all the suggested precautions. I would like to find out if it's safe for him to be in a crowded environment with so much heat and poor ventilation.
It's not safe.
Okay.
Poor oxygen saturation.
Okay.
Where there's a lot of crowd, it's not safe.
All right. That's from Efe in Takrade. So Doc says it's not good for him. Abek, was there anything else quickly? Righty, I see another one there. Good afternoon, Nortey. During the day, I do not cough, right? But during the night, I cough while sleeping. This is Evergreen Linda in Osu. She wants to know why.
A cough variant of asthma. He needs to come and we check.
Okay.
It could be a cough variant of latent asthma, which is probably now developing. So when it comes, we'll be able to investigate and check.
Hidden asthma. Okay. Right. Good afternoon, Nortey. For me, not having enough sleep, okay, that's a jingle. We've talked to him. Let me get quickly the last one so that we can... Right. Good afternoon. In this weather, I walked around with frozen water. Okay. Can't help it. By the way, I took pneumonia and flu jabs whilst in the UK in October.
The vaccine, right?
Yes.
Okay.
Nana on Spintex Road, right? But she says
you should regulate the intake of his ice water. Just
ice water.
Moderation is good.
Okay.
Yeah.
All right. Convenience and comfort might be a curse, right? So, yeah, we love the cold drinks. I don't think it's just water.
I know, right?
Yeah. Thank you so much, Doc. It's been great. One of these days, we have to have you live in the studio and not on Zoom.
I will try.
And I'll try and come by the polyclinic one of these days. Thank you so much.
All right. Nortey.
Thank you, Abeku, my producer, for doing your usual good job. Stick and stay on Joy 99.7 FM. My name is Nortey by nature. I'm out of here. And where's my thingy? Oh, there it is. Okay. Have a good